I would like to thank Representatives Lance and Crowley and the rest of the Rare Disease Caucus for hosting this meeting. I would also like to thank the other rare disease organizations and our sponsors for being here. I know that each organization is working hard for their own individual cause. My name is Allison Greenstein. I'm an internal medicine physician, and I am also a narcoleptic. I'm going to give you some background information so you can understand where I came from when I went to the FDA meeting last year. Tired. This was the only feeling I ever knew. I had plenty of reasons to be tired. Physicians work an average of 60 hours a week, often more. During residency, we verged up to 90. I remember having symptoms starting as early as my junior year of college, but I always attributed it to something else. I was too busy, I was not getting enough sleep. On the first day of internship, they made us watch a movie about sleep deprivation. They warned us about the deadly consequences. So when I started having sleep inertia, which is a loss of motor control and feeling of grogginess upon abrupt awakening, on a regular basis and almost every night on call, I really didn't think this was abnormal because they showed me a video and said, this is going to happen. So I thought I was just tired because I worked every fourth night in the hospital for 36 hours. But I wasn't just tired, I was just flat out exhausted. I started falling asleep doing routine things like eating and showering, and if you know me, my love of food is pretty substantial, so falling asleep while eating is a big deal. During my final year of residency, I finally talked to my family physician. I told him about my symptoms, but narcolepsy wasn't even discussed that day. But I knew by that point my level of tired was no longer normal. I had a barrage of tests including blood work, overnight pulse oximetry test, and when we finally settled on an overnight sleep study. In total, I had 4 of them. During my second sleep study, there was question that I was having nocturnal seizures. As I sat in the office of my third sleep study after my first multiple sleep latency test, I was expecting the same answer. You're tired because you're a physician. You're tired because you work too much. Heck, everybody's tired. But that day the answer was different, and that day they diagnosed me with narcolepsy without cataplexy. I was immediately given a prescription for Provigil and a follow-up appointment in 2 weeks. Provigil initially made me feel amazing. I no longer needed to take a nap after taking a shower. Things were going well for several weeks before I started having side effects. I began getting extremely short of breath. I had made an unconscious decision to stop taking the stairs, which is weird because I'm a half marathoner and was training for a marathon at that point. And I was now taking shortcuts to the hospital because I couldn't catch my breath. One morning I decided to take the stairs to the 3rd floor. When I got to the top, I couldn't breathe. My chest was tight, and I was pretty sure I was having a heart attack. I was supposed to be rounding with my interns. Instead, I walked down to the nurse's station and took my vitals. My heart rate was 180 and my blood pressure was 150/90. At that point, I really did think I was having a heart attack. We did more blood work, an EKG, a Holter monitor to look for heart arrhythmias, and an echocardiogram to rule out structural heart disease. But it turns out everything was fine, my heart's okay. My medications just make my heart beat really fast. Routine things such as laundry made my heart rate go to 150. I couldn't walk down the hallway without getting short of breath or having my heart rate go above 180. I had a hard time getting my medications regulated. I saw several specialists, including neurologists, pulmonologists, and cardiologists. Each time I was met with the same perplexity, kind of turn their head and look at me and go, "You have what? And you take what medication?" Many physicians know little about narcolepsy or how to diagnose this, despite our medical training. After several months, I was switched to Nuvigil, and finally a cardiac medication that kept my heart rate within reason. While I still have issues with my heart rate, I feel my disease is relatively well managed right now. I've had to ask for job accommodations in order to stay on top of my work, but I am thankful that I have several physicians who work with me to keep me both working and enjoying my life. Last year, I had the privilege of speaking as a panelist at the FDA narcolepsy meeting in the fall. I told my story and the side effects of my medications and the issues that I had. In addition to the side effects, I also experienced difficulty affording my medication when I finished residency before I started my real doctor job. Without insurance, my Nuvigil cost me over $500 a month, so it was either pay for my medication or pay my electric bill some days. I want to thank the FDA for allowing the narcolepsy community to speak to them. I appreciate them trying to understand my disease. While I did not get to use the nap room, the sentiment was greatly appreciated, and I personally think that all meetings should have a nap room. The FDA was extremely helpful for prepping for the meeting. They sent several emails and correspondence and followed up after. The staff was really fantastic. I don't know the exact number of people who applied to be panelists, but I know that there was an overwhelming response from the narcolepsy community. I am thankful that the narcolepsy community is very vocal about our disease. But only a few people were chosen to speak. When the floor was open for discussion, everyone really wanted to be heard. For many, this was the first time anyone had truly sat down and listened to them talk about their disease. People just wanted to share their story. They wanted someone to understand. Some of them just wanted to commiserate with other people and try to see who had the worst disease. Several people in attendance had never met a fellow narcoleptic in person until that day. Sometimes the questions that were posed were answered, but often the conversation deviated. We had a limited time, and I do not feel that all of the questions were fully answered. I've heard that this was the best meeting that the FDA had, and that actually concerns me. I was disappointed that there were not many pharmaceutical company representatives in attendance. We had an abundance of patients and patient advocates, and several hundred people who attended by webinar. When we asked the FDA questions, we asked if there were new medications or treatments in the pipeline for approval, and we were met with an answer of, "We can't tell you that information because it's proprietary information." When we inquired about research, we got the same answer. The last medication approved for narcolepsy was approved by the FDA in 2002 for narcolepsy with cataplexy. That coverage was extended in 2005 to include treatment for excessive daytime sleepiness. The drug was approved under the Orphan Drug Act, which was signed in 1983, and to give you perspective, I was born in 1982. The Orphan Drug Act was designed to encourage pharmaceutical companies to find treatments for rare diseases, but the FDA approval process remained the same. As both a patient and patient advocate, I feel my day was almost wasted there. What is the FDA going to do with this information? How are they going to design new drugs for me? The FDA doesn't really design drugs, and they don't promote research. Where is this information going to be applied? The Food and Drug Administration Safety Innovation Act allows them to expedite the approval of medications considered breakthrough therapies. I urge the FDA to use the list of symptoms and side effects to find medications to improve the quality of life of narcoleptic patients. Excessive daytime sleepiness and cataplexy are our big symptoms, but if you listened in the meeting, there was a long list of other symptoms that included brain fog and automatic behaviors that are just as debilitating to us. I hope that the patient focus group will address some of these other symptoms. I challenge the FDA to participate in drug development for narcolepsy and other rare diseases. You spent time listening to the patients, and you now have become our voice to the pharmaceutical companies. There are many symptoms that are not listed in the medical textbooks. Help them see I am more than an Epworth Sleep Scale number. Together we can improve the quality of life of many narcoleptics, myself included. Thank you.